Hey everyone, it's Bash. I'm here with Dr. Casara Andre because I put my dog Rye on a CBD supplement for her arthritis by Vet Sciences called Vet Mobility Chew. She responded great, but I got fascinated by this whole legal issue surrounding CBD oil. So who do I reach out to? None other but Dr. Casara Andre, because she leads up a group called Veterinary Cannabis. It's out of Colorado, and she knows this topic backwards and forwards. Dr. Kucera, thank you so much for being with us today. Tell us a little bit about how you were drawn to this topic and a little bit about your organization.
Awesome. Thanks. I'm so excited to be chatting with you today. This is such an important topic in all of veterinary medicine. Just a personal story first. I'm so happy that your dog is doing so well, but that mirrors my own. I have a 17-year-old, very creaky IBD, arthritis, just messed up cat who has been with me for a long time. And I put her on cannabis products and really saw it change her life. So from the personal side, that was how I got involved and interested in cannabis. And then at the same time, we run a co-working group here in Denver, Colorado for a lot of the mobile acupuncturists, rehab vets, really helping housebound animals. So that tends to be older pets, hospice scenarios. So from that community, the pet parents were really driving this question. They were so interested in cannabis, really wanting to explore cannabis. And then as a veterinary community, we felt like we didn't have good answers for them. We didn't know what to say. We didn't know where to look for research. And so veterinary cannabis as an education consulting company really comes from trying to answer the question that existed in the veterinary community, giving veterinary professionals a great resource of science-based information that they could feel confident sharing with their pet parents.
So talk to me about the whole legal issue. In my own experience, the vet kind of pulls me to the side and sort of sotto voce, tells me about this CBD supplement that I should consider putting my pet on. And so, then I do a little research and I find that there's this big disparity between I'm able to come home, I'm able to look it up online, purchase it online, have it shipped to my home, and yet it's from my understanding that vets can't even recommend it or prescribe it. Is that correct?
Yeah, it's such a great question, and it's a murky area. So there's not a simple answer. It's kind of, you have to understand some of the background information, but you've hit on one of the really frustrating aspects of cannabis medicine and as it touches the veterinary community. So just a little bit of background. The DEA, which is where veterinarians have our DEA license through, is a federal organization. So at the federal level, they don't like cannabis. THC, CBD, cannabinoids. No, veterinarians are not supposed to prescribe cannabis. We are not allowed to do so because we have a DEA license. However, at the state level, states can make their own laws concerning cannabis. And so then that's where this different side of the picture, that you as a pet parent can purchase cannabis products either from a dispensary if you live in a state that has either recreational or medical cannabis laws, or online, no matter what state you're living in. So we see this huge disparity of veterinarians being restricted by a DEA policy, but their pet parents being able to purchase cannabis products and administering them to their pets on their own. And that piece, that separation, is where we're really concerned about the potential for harm. A substance being administered to a pet without the advice or the guidance of a veterinarian, and why we're really working to shape the language and the culture around this so that veterinarians can feel comfortable talking to their clients about cannabis.
Dr. Andre, I know that there was the published study at Cornell School of Veterinary Medicine showing the positive impact of Vet mobility treats when treating osteoarthritis. In fact, that's how my vet was alerted to the benefits of the product. And for everybody listening, we've included a link to that published study in the credits at the end so that you can read it yourself. I also know that Vet is supporting 3 other independent studies at Florida State this year, looking at the effects of CBD to manage oncology patients, seizures in patients, post-op pain in patients. So let's talk about the diseases that you think that, CBD and other cannabinoids can be used to treat.
Absolutely. So what we're seeing is really amazing effects with cannabis in pain, inflammation, especially pain that isn't controlled by non-steroidals or opioids. Cannabis just knocks it out of the park. We see amazing results in this area. Neurology cases, so whether that be seizures or just a vague dementia, even in some of the older pets, we're seeing cannabis make big impacts there. We see a lot of pet parents ask for advice using cannabis in cancer cases, and obviously cancer is a huge umbrella of diagnosis, but we are seeing effects there in generalized well-being increases or appetite increase. And then I would say behavior, so anxiety, behavior-associated diseases is another big category. That one's kind of hard too, but we see a lot of pet parents be interested in that aspect.
And I think if I recall from our conversation, you said that one of the things that your group is doing is you're taking a look at these patients with these diseases, the medications that they're currently on, and then considering whether or not there may be some adverse interaction if they add a cannabinoid to that.
Yeah, absolutely. And I'd actually just shift that sentence just a little bit to say we're actually really interested in looking in beneficial interactions that other pharmaceuticals can have with cannabis, because what we're finding is the application of cannabis potentiates, so makes stronger, more effective, lasts longer, a lot of our traditional pharmaceuticals. The potential bad is if the vets aren't aware that cannabis is being utilized, the effect of that pharmaceutical can be too strong. So then we can start seeing side effects because the dose is too high. So it has amazing beneficial effects, but only if everyone's on a team approach, knows what's going on, and we can actually start to reduce those other pharmaceutical dosages because they're being more effective. Does that make sense? It's actually a really good thing, amazing thing, but only if everyone's on the same page.
Yeah, and interesting too. So, and I'm sure this is going to be discussed at your upcoming symposium in Denver. First weekend in October, right?
Yes, absolutely. So October 6th and 7th will be in Lone Tree, which is a kind of south suburb of Denver. We're really excited about this year. This is our first year to allow vendors to come on site. So we're hoping to make some great connections between great products and the veterinary community. We'll talk about dosing and monitoring, which has been a huge question from our veterinarians. We're talking about evaluating products, so how you know if a product is good or bad, reading a certificate of analysis. And then interestingly, we have a couple of speakers from Canada. Canada as a country just legalized medical cannabis. And so how that has impacted the veterinary community is really of interest, because I think the United States is headed in that direction soon. And we'd love to learn from our neighbors, both good and bad. You know, what do we want our country, path we want our country to follow?
Are pet owners allowed to come to the symposium?
Absolutely. We would love to see pet owners. It is geared slightly towards the veterinary community and cannabis companies, but any pet parent who is interested, we'd love to see them there. This information is available for anybody.
If I can't make the symposium, do you have some resources that I can look at?
Yeah, absolutely. That's a great question. We've tried to divide it into sort of level of education that people are looking for. We absolutely have community-based classes. So we've done some for training groups or just private communities who want to learn about cannabis. So we go and talk about it kind of at that community level. Then we absolutely have training classes for dispensaries. So bud tenders to be educated about cannabis and be able to give better, safer advice. We have veterinary specific webinars or training classes for them. We can also do in-clinic training, which is really fun. We love to come in person if you're in Colorado, or by webinar if you're not in the state. And that's a great way to make sure that your whole clinic team is on the same page, from receptionist to kennel assistants, all the vets, the office manager. It's really important that you're all giving the same message as a clinic about cannabis. And then kind of that middle ground where we actually do a lot of our work, the most of our work is in technician training. We're offering a certification that's called Veterinary Cannabis Counselors. These are for technicians, either certified or on the job trained. We feel that these are the perfect people to really give that the oversight that we need for veterinary cannabis about products, about administration, but they're still able to understand the pharmaceuticals that are on board, as well as the diagnosis, and most importantly, keep the vet informed. So we, again, that team approach, everyone's on the same page, but we feel like the tech is specifically and perfectly placed to give that client education piece.
So technicians in the exam room with clients, are they risking their licensure?
So as a technician that does not have any intersection with the DEA, it's much safer for them to talk about those cannabis issues as long as the clinic's on the same page. So you always want to make sure the same message is being talked about.
That's cool. apropos, my little CBD oil patient, look at this cutie.
Look at that cutie pie.
My LVET mobility poster child with her words on her face. Listen, thank you so much for what you're doing. It's just great what you're doing, and it's lovely to know you. We have your contact information up on the screen. Good luck with everything, and thanks for sharing your knowledge.
Thank you so much. It was so great to chat with you and see your baby, see your little fur baby there. Thanks so much.